We had anybody else join?
No.
All right. Well, we've got a small group here, but Hakim, I want to thank you so much for taking your time this evening to come talk to us. We had Hakim guest speak at our Rotary Club here in Knoxville, and I thought it was so interesting to hear about your time in Afghanistan and some of the work that you've done around polio with the children there and just how the times have changed. So I really wanted more people to see it. And also, of course, because we're doing our Purple Pinkie Donut fundraiser, we're raising money for End Polio Now. We thought this would be a great time to get some more information, just get like a personal feel for what's going on out there. So why don't you tell us a little bit about yourself?
Yeah, thank you. And I really appreciate Rotary Knoxville for giving me this opportunity to be here, and I'm really happy to meet you all. And then, as you said, my name already, I'm Hakim Sohail. I have a master's degree in law, rule of law and democratic governance from Ohio Northern University. And then I did my bachelor degree in 2007 back in Afghanistan. And after that, I started working as a lawyer with the Afghanistan Independent Bar Association for almost 18 years. And beside that, I was working as a governance and legal advisor under the USAID projects for a decade. And recently, after the governments in Afghanistan collapsed and the Taliban took power of Afghanistan, as I work with USAID projects, I get a chance to have special immigrant visa, and we immigrated from Afghanistan in January 2023 to US, and I have come directly to Knoxville. And we are happy about Knoxville. It is a quite good city. Regarding, especially about myself, I get this physical disability due to polio virus when I was a child. Anyhow, I have overcome all challenges, and it didn't affect my life, although I had many challenges and restrictions. But the first rule that I have in my life is that accept the reality. I accepted the reality and move forward. It does not stop me, and I have tried. I did many physical jobs when I was a child. Although I did carpet weaving for 8 years. But anyhow, beside carpet weaving, I studied in school. I graduated from university. Even I studied abroad. I did my LLM in 2016 in US, which was a great opportunity for me. And all of this was because I had a motivation that the disability shouldn't stop me or prevent me from being a successful person in the community. And all these things motivated me, supported me to be an active person in my community. And I'm very happy that I have tried my best, and I had supported my community, my different or many local civil society organizations in field of humanitarian assistance, in field of government assistance, in field of rule of law, fighting corruption. especially in field of supporting people with disability. Back in 2005, I was working with Handicap International, French organization, which they are supporting people with disability. And in 2005, I supported 5 local NGOs to be developed in different fields of supporting people with disability. One part is, for example, supporting blind community, supporting deaf community. I was a member among the people who established the deaf school in Afghanistan, sign language, among supporting through Handicap International, these schools. And I'm very happy that I had some achievements in my life. Also, in 2010, in 2012, I have started leadership studies. It was an institution of leadership and management studies, which was supported by Morningstar, a US-based institution. And when I joined that class, I found many other motivated people, persons, men and women, which they were very active and they had a strong motivation to support their community. And the idea of establishing Rotary Club in Afghanistan became in that class, started in that class. And I'm happy that I was among those people that they tried to establish a Rotary Club branch in Herat province, Afghanistan.
It sounds like you haven't just not let your disability stop you, but you've used it to really be passionate about something and be a leader in that field and move the world forward, really make a positive contribution. I think that's incredible.
Yeah, thank you. Even my friends, my classmates, sometimes they joking me that you use your disability as a benefit. This is a benefit for you because it motivated you. It is, some of my close friends, even they say me, you're not a person with disability. You shouldn't say that you're a disabled person. And I'm saying, no, I'm not a disabled person. I'm just have some limitations in mobility, movement, not any other thing.
Right.
This is what yeah.
So you were telling us about the Rotary Club you established in Afghanistan, in Herat, and I think you
exactly.
have...
Let's start. You can see Herat province is located in west region of Afghanistan. Rotary Club in Afghanistan it started in 2012, but chartered in 2015. The Rotary Club in Herat implemented many projects in supporting the community. Among those activities, awareness raising about polio, about how to fight against polio virus and how to support the community. It was one of the activities. Even Rotary Club implemented a tournament, soccer tournament, under the name of Polio Free, and then back in 2013, 14 exactly, I don't know the date.
Was that a one-time thing, or is it annual? Does it still continue now after the regime change?
Unfortunately, after the regime changed, many Rotary members they have left Afghanistan due to security issues.
Tell us if you advance the slide. Or no? Thank you. Did we go too far?
Yeah. This is the Rotary Club, the first picture in 2015 when the Rotary International Charter. And I'm among these people, the middle. And unfortunately, one of our member was died. And about 90% of these people are outside. More than 10 people currently they are living in US in different states. And in each state or each country they are living, they're trying to support the Rotary Club in Afghanistan. For example, one of our members, Habib, the third person, he from the right side. He is living in San Diego, and they supported the Rotary Club in Herat, providing food packages to 500 families.
Wow.
To this connection with Rotary in California.
That's amazing. I want to, I know you have some slides about it. I want to talk a little bit about, it's so difficult to imagine living here. You hear it on the news, but how much life has changed. So if you want to talk a little bit about, the political situation and how,
Let's
just kind of set the scene. How did we get here? Where are we at?
Let's start from the civil war in Afghanistan. The civil war in Afghanistan has significant challenges and transformation over the years. The country has experienced decades of conflict, foreign intervention, political disruptions, all of which have had a profound impact on the civil society. Still, the situation in Afghanistan remains complex and unstable, with ongoing concern about security, governance, human rights, and social development. The civil war started back in 1970 in Afghanistan. Dark days, which we say dark days because the Taliban regime, fundamentalist group, gained the control of Afghanistan for the first time in 1996 till October 2001. They were in power, and they imposed a strict interpretation of Sharia law. During their rule, the Taliban implemented the repressive policies that severely curtailed women's rights, leading to their exclusion from education, work, and public life. For the second time, unfortunately, Taliban regime took power in Afghanistan in August 2021, and while the group claimed to have evolved, early indications suggest a return to their previous practices. Reports have emerged of restrictions on women's rights, media censorship, and imposition of their restricted interpretation of Islamic law.
So from 2006 until, 2006? 1996. From 96 until 2021, there was no Taliban in power, or Taliban was in power.
Taliban were in power. But after 2001, when unfortunately September 11 happened, then the U.S. government, with support of international community, they came to Afghanistan and dissolved Taliban from power. And in the last 20 years, it was a great opportunity for Afghan people for the developing their government, building economic situation, human rights, everything were in good situation. Although there were many challenges during last 20 years as well. Security problem, corruption, and still was like this. Unfortunately, again, when the U.S. troops left Afghanistan, Taliban took the power, and we back at the same place which we were in 1996. More than 5 million people immigrated from Afghanistan. They left Afghanistan. Currently, the situation in Afghanistan is worse. Taliban implemented many restrictions on women and women. There is no schools for women. There is no education after grade 6 for the women, and also all women are banned from works. They cannot work, which this affected on polio as well, because women had an active role in eradication of polio.
So aid workers and nurses administering vaccines, educating.
As you know, the vaccination process is not implemented just by health departments or by nurses and doctors. And in countries like Afghanistan, there were house-to-house vaccination program every month. Female and male staff, they were visiting house to house to find children and do the vaccination.
So were they working with the World Health Organization or UNICEF?
Yeah, in Afghanistan, there were many international NGOs who were supporting eradication of polio various,
Including Rotary.
Yeah, including Rotary, WHO, UNICEF, also Afghanistan Health Department involving with that process, and many other local and international NGOs that were. About polio, currently Pakistan and Afghanistan are the only two countries worldwide where polio virus remains endemic and persistently present. Currently, in this year, and as of August, 5 cases were identified in Afghanistan, all of them in Nangarhar province. Afghanistan has been organized by the International Health Regulation as a state infected with WPV1 with potential risk of international spread. The year 2001, as I talked at the government, witnessed significant and challenging transformation in Afghanistan, affecting all sectors, including healthcare and polio eradication initiative. During the first half of the year, there was a notable increase in areas that became inaccessible to the vaccination program. coupled with a surge in security incidents that severely hindered vaccination campaigns because in the first half of the year 2001, there was a fight among the government and the Taliban. Most of provinces and the state were under that war. On March 30, in Nangarhar province, 3 female volunteers tragically lost their life in house-to-house vaccination efforts, falling victim to unidentified assailants. On June, 4 male volunteers faced a similar fate in the same province, with 6 others sustaining injuries in a series of targeted shootings. The situation escalated further on August 15 when the government of Afghanistan collapsed, leading to assumption of power by the facto authorities. And in the initial half of the year, over 3.5 million children could not be reached due to inaccessibility and bans on house-to-house vaccination campaigns, which is a huge number, and in certain regions. While access improved later in the half year, more than 1 million children remain unvaccinated in each vaccination round due to the inability to implement nationwide house-to-house vaccination. In some areas, the mosquito-to-mosquito vaccination modified replaced the house-to-house approach previously used because Taliban banned women's wards, and now female cannot participate in polio vaccination. And then, based on our culture, Afghanistan culture, most families they don't like that the male visit their house alone and to the vaccination, and especially in the rural area, border of Afghanistan and Pakistan. This is why this restriction affected the whole process of polio vaccination in Afghanistan, which maybe currently the result is not seen because the polio it is not shown soon after it is spread at the national level and maybe outside Afghanistan. After 2-3 years, we will see the effect. I hope it doesn't happen. Anyhow, this is the reality. We come to Afghanistan.
And you think, so that was the situation in 2001, and it seems likely that that's going to happen again now in 2020, with 2021, since then, women leaving those positions, not being allowed to work, and men not being allowed to go into other men's homes. Is that, am I understanding that correctly?
Although vaccination process is ongoing in Afghanistan, but as I told, it is broken because one part of the community is not in the process, and you see a house-to-house process vaccination is narrowed down to mosque, community to community. You see, it is a big difference. House-to-house was more effective because everyone easily had access to vaccination, but now they have to, if they will to do the vaccination for their children, then they have to travel or go to the mosque or somewhere, some places near to their homes. And, anyhow, this will affect the process.
I see.
Ongoing risk of WPV, first national and international spread. There are many reasons that the international community should be concerned about the spread of polio again, especially zero dose unvaccinated zero dose. Even the presence of significant number of zero dose children, particularly in southern Afghanistan, is a cause for concern. There are children who have never received a single dose of the vaccination, polio vaccine. The risk lies in the potential for the virus to be reintroduced into areas with low vaccination coverage, especially in the southern region of Afghanistan. About restriction of women's work, how to talk. The other high-risk mobile populations. There are frequent movements of high-risk mobile population between Afghanistan and Pakistan. As we see the reports, Afghanistan and Pakistan are the only two countries that still the polio exists. And unfortunately, in the past years, all cases which were identified even inside Afghanistan, they were traveled from Pakistan to Afghanistan. The border of Afghanistan and Pakistan, they were identified, the route were in Pakistan. And now when Taliban took power, people immigrated in a huge number. Every day, Afghan people are not just because of immigration, because of health issues, because of trading businesses, they are traveling to Pakistan. And Afghanistan and Pakistan has a huge number of, huge border which is both countries, spreading the coronavirus, the polio virus, and even the coronavirus.
Right. I think it's interesting that you say that because, as much as we believe here that polio has been eradicated for a long time, we haven't seen cases until last year, since 2013, I think was the last one before last year's case. But we saw with COVID how quickly something can jump from country to country. Yeah. And so, it's easy to get into unvaccinated communities, just having one community, be traveled to or to travel out of that area for it to spread very quickly. So I think that's why it's so important to continue to have these conversations and learn about, what the barriers are and what what progress is needed and how we can help to eradicate this disease once and for all, so that it doesn't make a comeback and spread all over the world again.
Yeah. And about Pakistan, importation from Pakistan, the reports indicate that the PV ban from Pakistan into other countries such as Malawi and Uzbekistan. I cannot pronounce. Raises concerns about the virus' ability to cross international borders, and this is underscores the need for coordinating efforts to prevent cross-border transformation. Another reason, another concern is refusal for vaccination. Unfortunately, despite vaccination campaigns, some families continue to refuse vaccination for their children in Afghanistan and Pakistan. Reason for refusal include misconceptions about the vaccine safety and efficacy, religious objections, cultural issues, and health and development spaces. This refusal poses a significant challenge to achieving widespread vaccination coverage, particularly in marginalized and underserved communities.
Okay. So you mentioned a couple of reasons why people resist vaccines, cultural and religious. So again, I've never been to Afghanistan. I have not met a lot of people from Afghanistan. I'm happy to know you. How does we see it a lot here now in some religious communities, in some health conscious communities, that where information spreads and maybe it's not 100% accurate, or, there's a lot of fear from one case being blown up in the news and getting a lot of coverage, so people focus on the one bad case, right? Because there are side effects, there can be issues sometimes with vaccines, but not to the degree of what we see with the actual disease. So it's really important. So how do people in Afghanistan, learn about the, the science or the positive outcomes or the data? Like, is there access to that? Do people have information? Here everybody knows has the whole internet in their pocket every day. How is that in Afghanistan?
Unfortunately, in Afghanistan, one of the big issues that cause us all these challenges is education, lack of education, and lack of awareness in every field, even about the religion. Most people, they don't know their religion very well because there are restricted interpretation by Taliban, which have power in the Afghan community, or some religious people who are who has the idea of like Taliban, and because this happened because of 40 years war in Afghanistan. Most people are uneducated. Unfortunately, the level of literacy is very low in Afghanistan. And regarding the, as you mentioned, social media, internet, but unfortunately in Afghanistan, most people, they have restrictions. We don't have electricity in all provinces. Even most of provinces of Afghanistan, they have no electricity because no electricity, no stable internet, no economy. Good economy will affect on this issue, but unfortunately the level of poverty is very high in Afghanistan. Most people cannot have access to social media, to internet, to even to local TVs because of the economic situation or many other reasons. And this totally the uneducated community will face many challenges that the Afghan community is struggling with this issue. And for now, as Taliban funded all education for female, we can say 50% of the communities for 2 years they restricted to be educated. After 10 years, after one generation, we can see the bad effect of these rules, this provision that implemented on Afghan women, because 20 years later we will have a huge community of mothers who are not educated, who cannot support their children, who cannot read and write even, to be educated, to know about many kinds of issues, including the pandemics that happen, like corona, like polio, like any other diseases.
So aside from getting people to understand the complexities of polio and vaccination and all of those things, you also don't have a broad audience. So you have to talk to each person one-on-one almost in the whole country in order to get the message to spread.
Yeah. And in the past 20 years, social media and especially communication had good improvement. Unfortunately, Taliban restricted the social media and education and any type of social media in Afghanistan, which can affect unfortunately.
Yeah. So I want to take some questions from our massive audience. Do we have some new people on the Zoom? Nice. But I do want to talk about the one initiative that you mentioned, the soccer tournament. And I know that sports kind of overcome everything, right? You know, no matter how difficult the times, we somehow still manage to cheer during sports times for games and teams and those kinds of things. So how you have access to a slightly larger group when there's a tournament. So how were you able to leverage that into a vaccination event?
Fortunately, any tournament can have can raise the awareness in a huge community, because even for those people who participate in the games, each one has a connection with different families, with many families around them, and any tournament which implement among, for example, 10 villages, you see all 10 villages will attend the tournament from all 10 villages. The people will attend to the tournament, and easily people will be aware of the one issue, for example, polio. These kind of tournaments in the past 20 years implemented in Afghanistan by local and international NGOs based on different projects, and it had good effects and outcome for the community. But unfortunately, currently, in the past 20 years, there were no tournament from Rotary Club, or I didn't hear any about any other organization exactly to fight against polio virus.
So do you, when you had them, did you just vaccinate at the events, or did you also send vaccines back with the people who came back into their communities?
The vaccination process were not with the tournament. It was just awareness raising.
Oh, so then it was still house to house.
Let me show something.
Can you advance this?
Oh, it's what I'm typing in the chat. Go ahead.
These are the type of tournaments, just from different teams they are attending, and it is just awareness raising.
Okay, so you didn't vaccinate at the events?
Yeah.
So, do any of you have any questions, comments, follow-ups?
I'd like to hear about Hakim's experience in Afghanistan between 2001 and 2021. What kind of work did you do? What was the country like, and how did it change?
Fortunately, the 2001, after 2001, when the international community came to Afghanistan, Afghan people, they had a great opportunity in every field, governance, rule of law, and economic situation, and education sectors. In every field, there were thousands of projects which implemented by international community, and many Afghans, they were involved in that situation. And there were hope that Afghanistan will be on the track, and the democratic process will ongoing. Unfortunately, everything is collapsed. All the achievements, I think, they are gone, because this new de facto group, they change everything. They don't accept, even they announced that the laws which were developed during the past 20 years, they are against the Sharia. We should rewrite it again. And this is everything, the justice system, the court system, everything is changed dramatically. In my idea, like me, many other Afghan youth generation, they thought that Afghanistan will be good someday, and because the process of taking the power in Afghanistan were in a democratic process, although there were corruption, there were fraud in the process, but still there were hope that this process will improve. But currently, many other Afghans like me, we are hopeless that if the international community will not give another chance for Afghans, like 2001, that there were a huge support from international community, but this will not happen again, and all the achievements were gone. It is not seeable what will happen. I cannot say so much about this because everything changed dramatically. Yes, please.
So, if the U.S. had not gotten involved in Afghanistan, would there have not been such achievements that have now disappeared? And do you think that the Taliban can change their Shia attitudes in the future, in the coming decades?
Unfortunately, the international interruptions in Afghanistan is almost, it is from since 1996, international community involved in Afghanistan situation, politically, economically, everything. But if although the U.S. interruption with international community, the goal of this interruption were to dissolve Al Qaeda and Taliban, but it creates an opportunity also for Afghanistan. Although they dissolved Al Qaeda back in 2001, now some reports shows that Taliban still have a connection with Al Qaeda, and nothing changed for the goal which international community leading of U.S. government to dissolve Al Qaeda. Everything is gone, and we are at the same place which were in 2021. And I think Taliban cannot be for a long time in Afghanistan, because every country should have a system, a government system to support the government and community. Unfortunately, Taliban government system is traditional system. They are not relying on the new technologies or new approaches which is implemented by other countries. Then I hope they come soon, a democratic governments or contribution governments come again. I don't know, I answered the question.
While you were there, did you notice any stark differences between the U.S.'s healthcare system and Afghanistan's?
Yeah, the healthcare system is much different in Afghanistan and U.S. Here, the insurance is a different part here. You see, everyone has insurance for the health. Unfortunately, in Afghanistan, there is no insurance. Modernized hospitals are not exist in Afghanistan. Even in the past 20 years, with all that budget which have come to Afghanistan, but still there is no qualified hospital in Afghanistan. This is why people from Afghanistan, for different or minor sicknesses, they are leaving Afghanistan to Pakistan, to Iran, and India, because the health system is cannot provide support or assistance quality services to the people.
So here we have well baby visits and regular checkups, and the kids get a whole set of vaccines at different intervals. They don't have that opportunity.
Yeah, here you have a mandatory vaccination for the kids before entering to the school, even to the kindergarten. There should be all children should have been vaccinated to be eligible to enter to the school, and it makes parents to take care of this issue. They have to regularly report it and visit doctors, PCP, to take care of their child. And unfortunately, in Afghanistan, because of many reasons, we don't have these services.
Do we have any questions from the chat?
No questions from the chat?
So one more question. So given that the Taliban is a Sunni minority, why do they have the attitudes that they have, and why do they refuse to change in Afghanistan?
It is not the Taliban, and that the Taliban are Sunni. Mostly they are Sunni population, but currently it seems that they are claiming that they are not against any other religion or any other field or type of religion. For example, as you mentioned, Sunni and Shia. Currently, in Shia community also they are doing their religious practices in Afghanistan, just because of maybe this is if there is any issue or against Shia population because of the restriction of medias or because of the power of Taliban, it is not reported or cannot be reported outside.
Did that answer your question?
Yes.
Thank you.
I think one of the things you mentioned was that you hope that democracy will take a foothold. Do you think that in the 20 years that Afghanistan got to experience that the population that grew up during that time, or that is now in their 40s, 50s, would be able to leverage that experience that they had over the 20 years? Or otherwise, how would it change? Why would it change?
This should change from inside Afghanistan, because we experienced that any issue like democracy which come from outside of Afghanistan, it is although it is implemented, but the outcome was not good because it came from outside. As you know, even democracy in US, it took a long time. They had a long journey to be at this level, and then how we can expect that in 20 years with democracy become a model or a rule in Afghanistan and not collapse easily. The best way is to educate people of Afghanistan, to give power to people of Afghanistan, and from inside it will have a good outcome. But unfortunately, even with support of international community in the past 20 years, we had that corrupted governments which collapse easily, and I don't think that even in 20 years, will be more than 20 years, we can have the same level of democracy as we had in the past 20 years in Afghanistan.
We're right at our 1 hour, so this has been really fascinating. I hope that more people will watch the recording than what we have here in person today, but I really appreciate you again taking the time. And is it okay if we put your information out if people have questions?
Sure.
And also, you're teaching here at UT, but you'll be looking for new opportunities in December. So if anybody wants to reach out with opportunities, that would be a great thing too.
Yeah.
Excellent. All right.